that many of us have a title that says our role is around philanthropy, but I believe for us to be truly successful in our roles, we have to embrace that we are healthcare executives. We are not nonprofit executives. We are not foundation executives. We are healthcare executives who happen to have a deep expertise and focus on advancing philanthropy. I believe that if we cast the net in that way, we simply think about our work and how we plug into the larger strategic objectives in a smarter and more meaningful way. I believe it frankly also positions us better to collaborate with our other leadership colleagues. They want to know that we deeply understand the healthcare industry, that we understand the implications of things that are going on now, and that we see how we're positioned to provide solutions. We don't want to be kind of a one-act pony, if you will, that all we can talk about is philanthropy. We need to look at all the connective fiber between our work and the work going on around us. So with that, you've already heard several of my colleagues talk about issues and trends in healthcare, because we do see that understanding the context of this very complex and evolving environment really informs our work. It also informs our allocation of resources, our intentions, the way we position ourselves in the organization. So it is no secret to any of you that we are part of two different industries that are undergoing massive change. Healthcare, certainly as an industry, is repositioning. We've seen organizations start to move from being paid based on volume to being paid based on value. We see healthcare organizations defining their vision of their role and of potential. We see healthcare organizations that are involved in risk and innovation and issues that they had frankly never dreamed about 10 years ago. So there's just a state of constant flux in healthcare. We've also frankly seen for more than a decade tremendous financial pressures in healthcare, with the typical healthcare operating margin hovering around 2% for the last decade, and with Moody's Investor Service saying we need a 5% operating margin just to stand still. So our work in this healthcare space is highly relevant. We're also certainly part of the nonprofit world and of philanthropy. And we know that we have changing donor expectations. They want to invest in different ways. They want to see us behave in different ways and allocate and manage their money. They want us to communicate with them in different ways. So by the time we come to the convergence of, or intersection of these two massively changing industries, certainly our place, the position we occupy on the field, is one where we have to have the ability to be agile and to pivot and to be proactive in thinking about where we must go next. So I want to talk about a few things that are on my mind today, and I'll tell you that I'm going to kind of run the gamut all over the healthcare field today with things that I think are important for us to consider now. First, we started today by saying, healthcare has been in the midst of the COVID pandemic, that we have kind of single-handedly in many ways borne the brunt of the emotional and physical toll of things that have been going on. I think about the stories that I've heard from several of you. One of my colleagues, who I believe is on the phone today, told me that she has tractor trailers that are refrigerated parked outside her door, and that it's a constant reminder of those who lost their life to COVID and are now in this frankly ungracious and undesirable space because there is no other option. I've talked to others of you that you've been evacuated from your offices because suddenly your office space was so precious that it needed to be utilized for COVID patients. So the stress beyond just our everyday job, even for our philanthropy teams, has often been acute. There have been constant and daily reminders of the significant toll that COVID has taken on our organizations and on our communities. We also know that our physicians are in an interesting place, because so many elective procedures were canceled back in the spring and then again in the late fall of this year due to COVID spikes. There are a lot of people that delayed care. There are a lot of other people who simply did not want to come in our hospitals. They thought that was the last place they wanted to be in the middle of a pandemic. So there are people who have delayed routine care, even some chronic care. So right now, a lot of physicians are facing patients who are sicker, or patients who have allowed issues to fester during this period of time. So not only have they faced the incredible pressure of navigating COVID, but they're now having to navigate the aftershocks, if you will, in many organizations. However, there have been, frankly, some bright spots that have come out of COVID. One of those is that we had to innovate quickly, and it has given us the ability to perceive new ways to deliver care and to work that we didn't perceive before. So there are going to be some things that are worthwhile for us to carry forward, and so we must consider that too. I also thought it was interesting to see a study that came out from McKinsey where healthcare leaders were asked what the long-term implications would be of COVID. And 90% of executives said they expected COVID to have long-lasting implications that would not go away. And so it's going to fundamentally change in many ways how we do business. And it means for many organizations, we're going to have to recalibrate our path to creating value. Now, in this, I think it's really important for you to see yourself as part of the solution. And with all of the issues that we discussed today, I want you to look at how philanthropy engages and how philanthropy intersects. I want you to look at kind of where the puck is moving, to talk as Wayne Gretzky did, because we've got to make sure that we're ready for what's next and not just what we've been historically doing. We know that this is also in an environment and in the context of acute historic economic pressure. As I mentioned at the beginning of our day today, the American Hospital Association said they anticipate losses from hospitals to run in the range of $323 billion. Now, on one hand, there was relief that came from the CARES Act, but for many organizations, it's just not going to go far enough. I've also talked to several hospitals in the last few weeks who said that even mounting vaccination campaigns has been really difficult for them, because while they're getting some of the costs offset by the government, there are other costs that they're having to shoulder if they're going to get vaccines out quickly. Little things like the time of nurses or the presence of syringes. And so we know that there not only is the loss that is there, but McKinsey estimates that we'll have another $125 billion in incremental costs. As you can imagine, for an organization that has frankly already been on its knees in many ways, this is going to be crippling for many organizations. There are already hospitals that have announced that they will not survive this time. For many others of you, it's going to mean a time of economic uncertainty, potentially a time of austerity, certainly for many a time of furloughs and reductions in force. It is a hard time to be in healthcare, which somehow just seems so unfair when this industry has stepped up to shoulder so much and do so much. We've also got to look at other financial implications that are going on. In the midst of COVID, we had about 10 million people lose their employer insurance. Now, that also was abated in some part by credits that came out and other things, but we have 10 million people who kind of got off one boat and didn't know how to get into the next raft. So that has been challenging for many organizations too, who weren't sure how to then reconnect with support for their care. So in this financial environment, the first thing I would consider you to do is examine the efficiency of your own investments. This is no longer a time that you can afford to carry things that are not providing you with a significant return on investment. This is no longer a time that you can carry things because they're fun or our community likes them or they're interesting if we don't know that they are either initiating, deepening relationships or raising considerable money for our organizations. So I would encourage you to frankly get out your sharpest, reddest pencil and go through the list of all the programmatic endeavors and all the budgetary investments that you make and look to see if there are places that you can cull down and cut out. As I mentioned at the very top of today, I think it's the perfect moment to reconsider. You can in some part do it under the coverage of COVID, if you will, to go to your board and say, it is time for us to recalibrate. It is time for us to pivot. If we are going to provide an optimal impact on our institution going forward, these are the things that we must have have the courage to consider or to do now. So I believe cleaning your own programmatic house is part of where it starts. But you've also got to reconsider where your investments are going. Are there high yield efforts that you're not fully optimizing now? For example, it absolutely breaks my heart to see organizations that don't have a meaningful relationship-based giving program. It breaks my heart to see organizations that haven't advanced meaningful clinician engagement. We know that these are powerful relational levers, and frankly, we are in the relationship business. And so we've got to do what we can to forge those authentic, meaningful, purpose-driven connections with those who would be donors or would be allies in this effort. So as you look at some of the high yield efforts, you know that it's often around things where people are making investment level gifts because they deeply understand and deeply believe in what we're doing. So think about the things that need to add to your list there, because sometimes making strategic investments that are going to yield more revenue for your organization are even acceptable in a time of austerity. You know, with that, a conversation that I know you've heard already today from a couple of my colleagues, and you'll hear from me if you're here with me for very long, is about alignment. I talk a lot to executive leaders and to philanthropy leaders about strategically aligned project selection. There, frankly, is too much money that is wasted out there. We have too many organizations that are raising money for things that are not important, that are not strategic, that are not going to move the dial. We too often are taking on raising money for things that got cut off the capital list because nobody cared about them. So now is the time to go and sit down and have a conversation with your chief financial officer to talk about what are the most important and transformational investments that are on our radar right now. What's embedded in our strategic plan, in our master facility plan, in our community health needs assessment, and in other documents of record that articulate our vision of potential? Because those, frankly, are the only things we should be raising money for. We need to stop trolling the halls to ask people what they need. We need to quit being the court of last resort for people who didn't get the money they wanted in their budget. We need to make sure that we are positioned as a vital and important revenue source of our organizations that is recognized and valued by executive leadership. So those are a few places to start. And frankly, the opportunity right now is significant. As I mentioned earlier, healthcare remains at the center of the national consciousness. You know, we've seen in past disasters and times of crisis that donors tend to pivot to the sector that was affected to step up and help there. And we've certainly seen that. The record numbers of donors coming in to help fund COVID-related causes have been extraordinary. So on one hand, you've had the spotlight, you've had this moment, and for many, that moment still continues. But part of what you've also got to figure out is how you're going to retain those donors going forward. One of the things we know about many of these donors that step forward in COVID is that they are kind of like firefighters, that they step in to fill the gaps, or they step up to address the urgent, that they're not into everyday sustainability. They may not even be interested in advancing the quality of your care. They want to make sure that when there's something that must be done, they're the folks who kind of run to the scene to make sure it happens. So you've got to consider, in my mind, the new points of urgency in your case for support. We're going to talk a little bit about one of those today, and that's health equity. I think health equity is one of the most important things that we need to be raising money for, and frankly, it is status critical. Frankly, it is status urgent. So we'll talk a little bit about that in a few minutes, but I do think we need to be thinking about how we're going to continue to court and engage community donors in addition to our primary base of grateful patients and families who've utilized our services and understand our mission in action. You know, here's the other thing. Innovation in medicine right now is amazing. We have great stories to tell, even beyond COVID. Healthcare is going through breathtaking clinical innovation. You look at all the things that are going on right now, like precision medicine, robots, artificial intelligence. There was a study that came out, which I cannot come up with a citation for, that said that AI is 15% more correct than a physician is. And And within the same study, it talked about the fact that when people used to go to medical school, that the knowledge they gained was good for 50 years. It should carry them through their career. But now their knowledge is good for about 17 months. So knowing the pressure that many of our physicians face, they don't have time to sit down and cull through every medical journal that is out there. They're going to become increasingly dependent upon artificial intelligence, machine learning, and other ways to make sure that we are always staying on the leading edge of this evolving clinical frontier. Now, I think that's exciting, and it's a great story to tell, but the innovation, goes beyond even that. There are interesting things we're doing that, you used to go to medical school and you worked on a cadaver. Now in many medical schools, you actually work in virtual reality. There's no cadaver needed. We've also gone from 3D printing of things like bones to bioprinting of things like heart tissue. Amazing, revolutionary changes. We've also got things that are kind of simple, but I think also have a huge whiz-bang factor to them. You can now monitor your vitals on your Apple Watch. You can now have wearables that will transmit your daily vitals to your physician. All of those things are coming together to change the face of healthcare, how we perceive it, how we interact with it, the quality of what it can provide to us. And so this is a new story that we must learn to share. This story, especially of technological innovation, is going to be really exciting to some and terrifying to others. There are some folks out there who are so worried that our robot is going to be like a George Jetson robot that's out on its own, doing its own thing. We need to be able to unpack these stories in a meaningful way to let people understand what the value is, but also to take the kind of fear of loss of control out of those stories. But startling innovation, it's something that I think you need to be actively culling for those opportunities, because they may not show up on your regular list. They may not show up on your capital. They may not show up on your operating budget. Sometimes those solutions are being brought in from external providers and third-party partners. And so it may not be something that we are making an investment in, but something that we are utilizing in the course of care. So you've got to have those conversations with your executive leadership to figure out not only what is evolving in the marketplace, but what specific impact is that going to have on your facility right now? So there's another area of innovation that I think is also important to get our heads around, and that's digital transformation. Digital transformation is something we frankly talked about for a long time, but COVID forced many to adapt or to adopt things that they weren't ready for before. So, figure one of the game changers is that COVID changed regulation and reimbursement, particularly around telemedicine, around remote monitoring, and virtual hospitals. So when you look back just a very short period to 2019, in 2019, which does seem a world away, doesn't it? Only 11% of consumers had ever utilized telehealth. When you look at 2020, 46% said they had participated in virtual care. So, more than a 400% increase just in the span of 12 months. There was a big study that was done by Forrester as well, where they said they anticipated that 1 billion virtual visits occurred in 2020. Now, here's the thing. When you talk about lasting changes, lasting implications of COVID, this is one of them. We had many insurers and other payers who are going to continue to reimburse for virtual visits. Now, many organizations, frankly, put together their strategy in COVID with bubblegum and duct tape. So for many, they've got to go back and reconsider their delivery mechanisms, how they're going to engage with patients. But there was a report that came out from McKinsey that said that about $250 billion of US healthcare spending would be transitioning to telehealth. So it's a place we've got to be on our game, and we've got to start addressing it proactively, because for many, telehealth is going to become a source of competitive advantage. It is not a place that we can afford to be left behind. It's a place that we will increasingly see routine appointments, appointments for chronic care, getting second opinions, and mental health visits. Those are becoming incredibly prevalent. So when you think about the new digital frontier, one of the things I would ask you to consider is, how are you intersecting with this space? Is it even on your radar? Are you raising money for virtual hospitals? Are you actively engaged in these conversations? Do you understand the forces that are at play? Have you talked to your boards about this? Because raising money for capital is great. It's great, but it's what we've done for more than 40 years. It again goes back to, we gotta look at the curve that is emerging, not the history of where we come from. And so we've got to make sure that we are positioned with the tools, the resources, and the knowledge to meaningfully intersect and engage in this space. Now, there's a tangent here for philanthropy as well. It's no secret, and even Mike Bell talked about this a little bit earlier today, that philanthropy's digital front door has also been burst open by this. We see virtual visits with prospective donors and with current donors. They're here to stay. They're not going to be something that were just a stopgap during COVID. There's something that we found, frankly, worked. Many donors, frankly, were very comfortable in that space. They liked that they were sitting in their living room in the comfort of their favorite chair while having a meaningful conversation with us, rather than having to jump in their car and come downtown, or rather having you walk into their door. And so we know virtual visits are going to be part of our paradigm for going forward. With that, I think one of the things we've got to consider, if you've not already, is how you are counting those visits. Visits have always been about being face-to-face, but I believe now visits need to be about the quality and intention of the interaction, not about the venue, because physical venues and virtual venues can deliver similar results. And so we've got to think about that. We also, within COVID, had a lot of organizations that very quickly stood up virtual events. Some of those virtual events, they're here to stay too. They were different in nature. They attracted a different constituency. They sometimes enabled you to have a different price point. They enabled you to keep down your overhead. And so there's a place for physical events going forward, but there will likely be, for many, a place for virtual events going forward. So you've got to think about how we're going to harvest the best of what we uncovered here and make it part of your work. Now, with both virtual visits and with virtual events, I would say there's a call here for us to meet donors where they are. I had the conversation with Tara Bano from Modern Healthcare, I guess about a month ago. And Tara said, what separated the organizations that were successful raising money from COVID from those who weren't, in your mind? And I said, it really in my mind came down to, did we hit the pause button or did we keep going? Because there were a lot of organizations who said, well, we can't meet in person, we just won't meet at all. Or, maybe it's distasteful to meet with people over Zoom. And so there are a lot of organizations that just stopped. When they stopped, they squandered incredible opportunities for connectivity. They squandered incredible opportunities to steward donors and let them know how their past investments had positioned the organization to be successful in this moment. And so we need to meet donors where they are, whether it's in a virtual visit or whether it's engaging with them in the communication formats that they want. We know a lot of folks like me, we're tethered to our phones now. Engage with me here. Don't drop stuff in my mailbox because my mailbox is full and I don't care about what you're sending me there. So to think about overcoming, not creating artificial barriers, creating multi-channel communication, adding digital experiences, enhancing social media, integrating online fundraising tools. There are a lot of opportunities for you to proactively address. But I would tell you, in looking at a lot of organizations' digital strategies and communication strategies, They haven't thought about them. They've let them happen to them. They don't have a strategic communications plan. They don't have a specific budget that's allocated to the task. And so if we're going to work well, perform well in this new environment, just like our hospitals need to think about creating the right infrastructure for telemedicine, we need to be thinking about creating the right infrastructure for digital engagement. Now, let's talk about another form of engagement, and this kind of goes alongside with the telemedicine, virtual medicine trend. We've been seeing over the last decade, and specifically really over the last 5 years, a significant outmigration of care. We're increasingly seeing people receive care in outpatient services, in ambulatory surgery centers that they didn't before. There was a study from McKinsey that said now the largest hospitals and health systems in the United States generate 60% of their revenue from outpatient services. Small hospitals, a little bit still behind them at about 40%. But here's the thing. It means people aren't walking through your front door. If they're going to be engaging in outpatient environments and now in virtual environments, they may never physically park in your parking garage, walk through your front door, and engage face-to-face with one of your providers. So I think you need to consider, how are you going to connect in this space? How are you going to be relevant and present in this space? So one of the conversations we've had with some of those we work with is, hey, there's a virtual waiting room and there's a virtual visit. Are you there? Are you present? Do you have a video? Do you have a story? Because there are a lot of people who are sitting there with downtime waiting for their physician to show up, just like they would in a regular waiting room. What else are you doing to talk to executive leadership of your hospital on how you're going to integrate and align with that space? There are definitely opportunities there. And I think, again, you need to be conscious of it, because us continuing to just mount the same old fundraising strategies will not be adequate. And frankly, it is not adequate now. Now, another big trend you also should be aware of, but I think presents opportunity to us, is around consumerism in healthcare. Consumerism has been a rising buzzword, again, over the last decade. There have been, frankly, some contentious comments about it. Should we call people patients? Should we call them consumers? Should we call them customers? Should we call them something else? But the trend has ended up falling under the name consumerism, but really it is focusing on, what do patients want from us? And what patients say they want from us is convenience, timeliness of access, a decreased cost of care. They're saying they want to engage with us differently. And here's the thing, the healthcare model used to be very hospital-centric, very provider-centric. In this new world we're going to, it's going to be patient-centric, person-centric. So we got to get our hands around this too. The other thing we've seen is that patients are not loyal to us. Patients are willing to readily vote with their feet and go somewhere else. In fact, there was a study which I laugh about because it's so miserable, that said that patients are as likely to change hospitals as they are to change hotel chains from one visit to the next. You know, I don't know about you, I travel a lot, I tend to stick to one brand, but if there's a better looking location, if there's something that is newer, if there's something at a better price point, sure, I'll change brands. I didn't feel like we would do that around hospitals. I feel like with hospitals, the stakes are so high that things like perceived quality and perceived trust would be really overriding factors that would push us to stick with one hospital system or not. Apparently not. People say, if you can't get me in quickly, if I can't park in your garage and get right in the door without navigating a bunch of stuff, if the price can't be in line with my expectations, I'll go somewhere else. And if we know that we've got patients who are not loyal and also a burgeoning number of non-traditional providers who are entering the market, it means we got to get on our game. So you all know you've got folks out there like Amazon and folks like Walmart who are starting to create clinics and deliver other services. My husband and I have laughed that if we really wanted to get a vaccine program out in the United States, it would probably be run by Amazon because the truck runs down all of our streets every day. So we've got to think about, these are other providers who have connectivity and scale and volume and resources that we often do not. These are providers sometimes who have logistics capabilities that we often do not. And they now are our competition. They're not just somebody who might get in our market. They're somebody who is definitely going to get in our market. So there was a study that came out from KPMG that said that 80% of hospitals said a consumer-centric strategy was a high or top priority for their organization. So your organizations are already looking at this. How do we meet those expectations? How do we create a frictionless experience? How do we make people feel that we're paying attention to them, that we understand them, that we understand what they need and what they want from us? How do we harness all of the data that is being collected to really understand who is coming through our doors? Those are the opportunities that are out there, and leading organizations are already moving on those issues, and that means you must too. We need to think about not just what donors are we going to screen to determine if they have affinity or ability, but what do we really know about people? How are we engaging with them? How are we responding what their needs and expectations are? Because we are also going to have to be more stakeholder centered in the work that we're going to do. Now, other opportunities. There was a position paper that came out from the American Hospital Association that was talking about the need to redefine the H. They said that the traditional definition of a hospital was no longer relevant in this new environment, that our hospitals were set up to reactively address illness and injury. However, the call now is around uncovering needs, providing preventive care, strengthening health status, nurturing well-being. The role of the hospital is no longer defined to the city block on which we sit or by the four walls that constrain our organization. We now increasingly see hospitals reaching out into the communities to engage with people in more meaningful ways. So have you considered what this means for you? If you even look at your bylaws. What do your bylaws say you raise money for? I've been surprised recently to go into a lot of organizations' bylaws and articles of incorporation and realize that their organizational documents constrain them to being very place-based in the grants that they're making. So if we're going to start to expand our venue, our areas of influence, our role, we need to start thinking about what this means for us. We need to start having conversations with our boards of directors and other allies and with our executive leadership. And for some, we need to attend to what do our bylaws and organizational documents say, because we want the ability now to reach outside and do things that maybe didn't seem possible to us before. Now, one of the issues that I think goes right along with that is health equity. As we're reaching out into the community, there also are just frankly injustices and inequities to address. This has been a discussion, frankly, that's been going on for a long time. However, the need to address it is now at a fever pitch. As you know, two things happened in 2020 to really change the game. First, there was COVID, where the pandemic took an outsized toll on people of color. In fact, people who were Black, Hispanic, and American Indian were 3 to 5 times more likely to die than their white counterparts. That is certainly egregious and something that really put a spotlight on some of the issues that needed to be addressed. At the same time, there was outrage over the death of George Floyd when he died in police custody that really opened up conversations around racism in America, structural racism, and how we respond to people. So with those, I think that COVID has really illuminated the vulnerable underbelly of health inequity in our country in many ways. And now is no longer a time that we can continue to brush it under the rug or say nice things about it or say that it's on our radar, but we can't fund it. It is no longer adequate to be passive. It is no longer adequate to give it lip service. It is now time for us to stand up and act. We saw not only issues around racial inequity, but we also saw that whilst 15% of the population has identified and significant social needs, such as for housing, food, safe places to play, and other things, 15% of the population suffered from acute issues in that area. and 28% of people in that group died of COVID. So, you look at the inequities and just even death rates, treatment rates, again, for COVID. So when you look at widespread differences in health status, you're talking about a lot of different things. It's about illness, disability, mortality. And what we find when we look at these issues in our country is that these issues are closely linked to race, ethnicity, gender, sexual identity, and more. Even more, and you already know this, they are deeply intertwined with socioeconomic status, with educational attainment, with social power, and structural racism. So if we know that we have consistent and avoidable differences in access to care, in culturally competent care, in quality of care, it's time for us to step up and address them. We can no longer be the organization that is accepting people downstream that we have failed upstream. We now need to start being proactive in addressing what we're doing to start to elevate the health status of our community. Now, here's the thing. I talk to a lot of philanthropy executives and they say, well, that's not our issue. Like, we don't do that. We fund the hospital. We don't fund anything else. Well, it is your issue. Even if it was not before, it is your issue now, because it is one of the most important and strategic things that your healthcare organization needs to do. And while 90% of our healthcare executives say they need to address, however you want to call it, community health, population health, social determinants of health, whatever you want to lump it under, 90% of our executives say we need to address it. And the primary reason they're not doing it is funding. So once again, you have a solution. You're going to be joined later today by my colleagues Amy Dorrell and Aaron Lanahan to talk about this a little bit more deeply. But what we know is donors care about this. Donors want to be involved in this. They can clearly see the social impact of this work. And so if this was not your space coming into this day, this is your space now, and it's time to investigate it and figure out how you're going to proactively pursue it. Now, here's another thing that you may not be thinking as part of your role, but I think is a vibrant and significant opportunity for you. Figure again, if we're redefining the H of hospital, we are coming from an era when health organizations were largely insular in their approach. We were silos. We were bounded by our four walls. However, if we're going to start to address community health more broadly, it's impossible to do it alone. We don't have the bandwidth, we don't have the resources, we don't have the data, we don't have the relationships. We cannot do it alone. And so looking even further, if we know, looking at the Danish twins study, that 80% of a person's health status is shaped by social determinants of health and social needs, again, going back to food security, housing, other issues like that. If 80% of a person's health status is shaped by those things, how could we not see it as part of our business to address it? I talk to so many leaders who will say, we have someone who comes into our emergency department and we take care of them and we discharge them, and then they're back in 15 days. Woe is us. Well, sometimes it's because that person came into our emergency department, and when they were discharged out to the streets because they had no home. And when they went out to the streets, they couldn't sleep well. Their medicine got stolen. They didn't have access to adequate food. And so guess what? They landed back in our ER in 15 days. When that happens, not only are we failing to deliver on the promise of value over volume, but we are failing to see the very thing that is set up to trip us up over and over again. So we've got to start addressing some of these attendant issues if we're really going to address health. Now, with partnership, I perceive that you've got opportunities to have formal partnerships with nonprofit agencies. But I would also tell you that we are seeing a rise in public-private partnerships. There are places now for businesses and governments to come together to start to address these things. I would also tell you we're seeing funding from philanthropy and grants start to really overlap in the space. There is a lot of money that is out there right now to address health equity and other related issues. And so if your organization is not proactively pursuing grants from the philanthropy office, figure out who is. Is it coming out of your government relations office? Is it coming out of legal? Or is nobody doing it at all? This is an opportunity that if your organization doesn't have its hands around it now, it's time to do it, because we have opportunities in partnership with others to expand capacity, to fill gaps in the continuum of care, to access knowledge, to leverage financial investments, and more. And I believe if philanthropy is about engaging people in our work by bringing their contributions to power our plan, partnership is also an optimal place for the foundation to get involved. You know, let's be really honest. In your community, on your executive leadership team, you probably have more relationships with other leading nonprofit organizations than many others who are sitting around your table. You also know a lot of the influencers, the movers, the shakers, the people that get things done. And so you've got an opportunity to pull them in around the table. So as you think about your role, I would say it's not just philanthropy, it is partnership. It is about asking people to become meaningfully engaged in our mission through whatever resources they can bring to the table. Now, when we think about, let me go back to health equity. You know, one of the other failure points that we have there is around addressing mental health. COVID has certainly spawned all kinds of new problems there. There was a study that I saw recently that said more than 30% of US consumers indicate acute anxiety or depression coming out of COVID. For many of our organizations, we have not always perceived that addressing mental health is part of our mission to provide whole person care. However, mental health has strategic and financial implications. About $200 billion is spent annually on mental health, and it's something that is going to be, frankly, another rising point of pressure for healthcare organizations to address. So I know in the past, sometimes we've been reluctant about raising money for mental health or behavioral health. We've said, you know, maybe that would be uncomfortable. Maybe those are conversations that someone who has gone through that process wouldn't want to share publicly. I would say to you that the stigma around mental health is gone. Mental health is health. It's the same to have a broken heart as it is to have a bum knee. We've got to start getting out and engaging with people in a meaningful way, and that is also part of philanthropy's role. Now, talking about those who are in just a really heavy position right now, I think we've also got to think about the mental health of our clinicians. You know, going into COVID, that 44% of physicians and 63% of nurses said they were suffering from burnout, emotional exhaustion, loss of joy in work, and an array of other attendant and related issues. Burnout represents a significant source of risk to our organizations. As you can imagine, when half of our clinicians are burned out, patient quality, safety, experience all suffer, because half the patients that we're touching are being touched by someone who is not operating at the level that they want to operate. Now, we don't yet know what the unforeseen significant outcomes are with COVID insofar as burnout. Aaron addressed it a little bit earlier that on a study that came out, people didn't largely attribute their burnout to COVID, that they still saw it was other things like, you know, management tasks and other things. However, I think we know this is a moment, and this is again a place you have solutions. You can be part of addressing organizational culture. And this is a place, frankly, that I think you lean in on gratitude. There are multiple significant longitudinal large-scale studies that demonstrate the efficacy of gratitude in reducing burnout, increasing resilience, decreasing emotional exhaustion, increasing joy in work. Now, what was significant here to me is that the gratitude couldn't be coming from, say, your manager or your leader, that the gratitude was most potent, most powerful, most meaningful when it was coming from a patient or a family member. That's where you've got a huge opportunity, because again, you're sitting at that intersection to be able to influence that. So I would also take that on as part of what you're doing. This is a place that you need connectivity. It's time to go out to your leaders who work in patient experience and work in other places and say, how can we collaborate? How can we get together on this? Now, there are a lot of opportunities I see in front of you. Some are things that you're already kind of addressing in one way or another. For example, board engagement. Stakeholder engagement has always been a core role for your foundation boards. We know that foundation boards bring diverse social, civic, and business connections that are powerful, but I would encourage you to make a big play here. You know that your foundation boards, your development councils are already in alignment with your mission. But many of you don't have a meaningful relationship with your governing board or community boards. Here's what I'd tell you, and all the literature is saying this. It's like the lighthouse that is sitting off in the distance that we've been ignoring. The role of community boards and governing boards are changing. As organizations have become more geographically far-flung, community-based boards are more and more likely to be what many call JACO boards, that they have the primary function of fulfilling the regulatory responsibilities to assure quality of the organization. But for many organizations, they no longer have fiduciary responsibilities. They no longer have a lot of other responsibilities that used to be core to the community board role. This to me is a play. It's time to go and talk to executive leadership about how the governing board could take on a more significant role in advancing philanthropy and advocacy for the organization. They are connected to the community. They bring objective influence. They have unmatched credibility. And this is a point of leverage that may not have been present for you before, that I think is worthy of your pursuit. So with all of these things to consider, I would tell you, be agile, be diligent and cutting things off your list that don't need to be there anymore. Be thoughtful about how you're engaging your leaders. And at the core of it always, never forget that philanthropy goes back to the Greek roots that says that it is about a love of humankind. This is about love, purpose, passion, meaning. Don't let any of these things get stripped out of your work, because your leaders, your donors, and your team need this to go forward.